You get it? Thank you. All right, so we are very excited for, well, selfishly for us, but for our students as well, that we can get them documenting in our notes fully. And so it is now our policy and approved policy that students can document in the regular progress note, and that we can use that documentation. But for you to be able to use that, you have to know the protocol and the workflow for that. So we're going to go through that here today very quickly. So as far as this policy is concerned, you know, it's all up there. I'll send it out in email. You can commit it to memory if you'd like to, but I'm going to narrow it down because I know people like the skinny about what are the have-tos on this. So basically, in general, the policy says students can now document. They have to be oriented. You have to be oriented. They have to do this in an appropriate way. The workflow, we'll go over some here in just a minute, but the workflow is such as the students do their documentation, save their note after they've attested to it, and then you verify the work that they've done. It's very specific, the wording, so we've actually included that in the notes, and you may have seen that already. So let's think about this in a condensed version. Let's figure out how to pave the way with a mnemonic, because mnemonics are fun. So the pave mnemonic is going to be permission. We're going to talk about the student and you having a conversation, the student having permission to document on this patient. Number two, the student has to do their attestation. Critically important that the student clicks on the box that says they have done the work, because that gets the ball rolling in motion for what we have to do as well. And then for our part, we definitely have to do the verification. We have to document for, you know, good medical practice as well as, you know, Medicare, things like that. So the verification has to be there, and this should all be wrapped up by the end of the day. And so if you can remember nothing else about me looking stupid up here, it is this pave mnemonic about how the must-haves get done. Let me go into that in just a little bit more detail. So at the huddle or at the beginning of the session, you all have a discussion with the student who's assigned to work with you about, okay, these are the patients I want you to see, or any patient that you see I want you to document on, or, oh, don't document on that one. You probably don't want to get caught up in that hot mess. So have that discussion early on. It may be that, you know, you're working with a great fourth year student like Adam here, and you're like, hey, anybody you see, document all that you can. So that'd be fantastic. So it can be that implicit. Once the student has that permission, then they get to start up working in the note and seeing the patient just like we have in the past, but this time they're actually documenting in your note. So workflow is going to go like this, and we'll get back to our mnemonic in just a minute. But basically, students, you know, sees the patient after the nurse has started the note and done their part. So nothing changes at the front end. The nurse triages the patient, brings it back, starts the note. The note is started in your name as a provider. The student will then see the patient. They'll take the history. They'll document their findings there. This should include the HPI, but they can also update history, medications, past medical history, surgical history. The students can do all that as well. And then there's going to be a focal physical exam, and depending on the workflow, this has to be done, at least part of the exam has to be done with you. And that's for some interpretation, but you have to verify and have performed with the student the physical exam, as well as perform the assessment and plan. That's the verification that you're actually going to do here in a minute, and we'll show you that. The student is going to discuss the findings again with you, the initial assessment and plan. You're going to go back in as you have in the past, and then after you come up with that final assessment and plan, precept, if you're a resident, you're still going to do the precepting with the attending, at which point the student can be doing some of their documentation. Okay? The ideal would be the student then ends up finishing their documentation and saving the note by the time they're ready to move on to the next patient. Now, if you're busy and you trust that student to get done at the end of the day, we can modify that a little bit, but the ideal should be student finishes their documentation before they move on. You can move on, but they need to finish that documentation. Questions on the workflow before I get back to my cool mnemonic? Okay. So again, the attestation, you may have seen this. It shows up great up here if you come sit on carpet squares in front with the graham crackers. But back where you are, you may not see this, but you'll see this in the note down at the far end, and I'll pull one up here in a minute if you want to see it. But there's a box for the student to check on. It says student attestation. It's in the same portion of the table of contents that the resident attestation is at. The student's going to check on student, patient seen with, and is going to input your name. Okay, so that's their job. Once they've saved the note and you go back in it, you have to click on the verification part of it, which is the next click. So both of those check boxes need to be hit when the student is documenting in your note. In case you want to see that again. Hey, you've seen that before? Just a little smaller. So this one, again, you're going to edit the note. Once the student has saved it, you edit the note. You make any additions that need to be made. You make sure their note is good. Not good, it's great. And then hit that attestation button that says, it's got all the verbiage that has to be in there for Medicare, so you don't have to worry about that. It's all in there. Okay? And then you send it on for code signature, just like you always do with your notes. Again, that finally, in order to do a better job, make sure we're doing quality improvement and control on this, we want these notes to be done by the end of the day. You can interpret day with the way you want to. But yes?
You talked a little bit about, choosing how many patients you let somebody, one of the students document on and see. What's your expectation? That say you have 15 patients in a day, would you like a certain percentage?
Yeah. So the question is about the percentage of patients that you're seeing that the student should be involved with. Part of that's going to be the level the student's at. A first rotation third year student versus a senior student who's been here and rotated through with us before. It's going to be much different. The complexity of the patient they see is going to be different too. So the patient choose. You can edit that out. Choice of the patient is going to be key for you, picking the right patients for them, but also knowing the level of the learner you're working with. So it may be that one patient, they're working on that all day. As long as they're getting something out of it, I'm fine with that. So there's no set number they should have so many. Now, I would expect they do one of your notes a day at least, right? I mean, it wouldn't do either of you much good if we're not utilizing this for your good and their benefit as well. Because ultimately that's what we're, students feeling more useful, they're learning more. You get your note finalized for you and a lot of that work done for you, and you may even have a little more time to teach because of this. Those would be some of my end goals from this. Make sense?
No, it's a great idea.
Just kind of click by click workflow. Student opens up note first. It's our basic, it's our same note.
Yes.
They open it first, go see the patient, do their thing, come out to me, and at that point, then we go and see the patient. Can I take over the note then, or I guess they could even keep it and document?
Yeah, they can.
after?
I mean, they could be in. I mean, I hate to say scribe because that.
Yeah, I hate to say that too.
But,
That would be really helpful.
I mean, Adam and I worked together, and we went back in, and then he continued to do
Maybe
documentation.
Kind of like work on his note and kind of be doing that
Exactly,
while
and
I'm
final plan. So,
checking it
do you want
out.
to speak to that at all? I'll put you on
It
the
worked out
spot.
pretty well, because I would go in at first, then come out, and have been working on my note while I was with the patient. And then I come and spoke with Dr. Moore, presented the patient, and we went back in together. And while he was interviewing the patient, I would continue to fill out my note as he was speaking.
You haven't found anything else that you might have found that?
Right, that I didn't catch.
Okay. Then we come out and I have to do like the assessment plan, right? That's what we said.
They can write it up. Absolutely.
Okay.
Yeah.
So they can technically do everything. Like,
Exactly.
I don't have to type
That's
anything.
That's the point of the attestation box.
Yes.
So I
We say
I
that
click.
this is what
You got to verify all that they do.
Verify.
And make sure that it's right, and some of that may be teaching on what you like your format of note to be like
Sure.
too. So that's part of the whole process.
Okay, then he comes out, finish the note. He exits out the note, I go back in the note, I click my attestation box.
You
Send
look at it
Dr.
all.
Yeah, I
very
verify because we did it
proof
together.
fit, yes. And then
We
you,
went over it-
yes,
We went over it together.
exactly.
I verify, sign it, send it to you.
Yes.
100%.
Jesse.
What about like all the other little things we do, like we expect them to click like medications viewed, updated.
Right, so that's gonna be
That's,
a little bit dependent on the student you're working with. If they're at the kind of scribe stage of just being able to get that information in there and write the HPI, or if they're at the stage of, yeah, they went over the medications and they updated the medications.
when you say update the medications, does that mean they actually
They-
go through and do like renew with changes and like update the medication? Complete today, they do that?
They
stuff?
they can't do the prescribing of it, but they can get rid of any medications that are not any longer on the list,
So
or
they can-
add.
They can do the complete, they can get rid of the medication.
Exactly.
But they can't add in,
They could add record-only medications.
they can add record only medications, okay.
So can they do orders? And so
No.
I need to do orders.
So, no orders. So they can't put the lab order in, so you'd still have to do that. So the way I did that was, since we can't both be in the note at the same time, and that's the, the one caveat, I just did it from the clinical desktop screen. I renewed medications and ordered labs while he was still writing the note. Fair question. Other questions on that? Has everybody seen where the box is? Let me see how savvy I am here. Probably not. Hey. So the student would pull up my daily schedule, click on the box, they'd be doing their documentation in here as my regular note, and then as you come down here, there's this under the plan.
Oh, okay.
And so after Adam or whoever, they'd say, "Seen with Dr. Moore," maybe even spell my name right. And they would go ahead and save the note. They'd save and close, which we didn't do right last time. So, and then I'd go back in once they're out of it, and I could go and check all their documentation, make sure we're all, right on precise about their language, about what they documented was correct, and then all scripts will freeze. And then after the all scripts done freezing, I'll click on that little verification box that's going to come up here momentarily.
So if there were things that needed to be changed.
You can edit it, you can erase what they did altogether if they have to, you can add in anything you want to, certainly with the plan or assessment if you have specific ways you like to word things or say things. Cool. And, all right, sweet, and this works beautifully all the time.
Very cool. Best team.
Other questions?